At Scripps, we deliver superior service in a caring environment. Our mission is to make a positive difference in the health of every patient we serve. The surgeons and staff at Scripps are skilled in a range of medical procedures. We understand how the thought of surgery may bring on some anxiety. This short video will help answer many of your questions and explain what you can expect before and after your surgery. The approach we use to help our patients get better faster is called Enhanced Recovery After Surgery. This means your healthcare team will put together a personalized plan to help you recover quickly and return to your normal lifestyle.
Helen Smith.
Let's take a step-by-step look at how we will guide you through your journey to recovery following surgery.
Hello. Nice to see you again.
Leading up to your surgery, we'll give you critical information that you and your family members will need to know. You'll learn what to eat and drink and what to avoid leading up to your procedure. For instance, if you are a smoker, your doctor may ask you to stop smoking for a few weeks prior to surgery. We'll want you to drink plenty of water until it's time to check in. Being hydrated helps the body cope with possible side effects of medication and promotes healing. Your doctor may even ask you to drink a special carbohydrate beverage the night before surgery. We'll also give you instructions about taking or stopping medications in advance of your surgery. And your doctor may prescribe antibiotics or direct you to stop taking blood thinners. You should follow these instructions carefully. To avoid infection, we will give you antiseptic wipes and washes to use the night before and morning of your surgery. On the day of your surgery, you will check into the pre-op area and meet your surgical team.
Hi there, I'm Dr. Students. I'm going to be the anesthesiologist today.
You will be asked a series of questions by the nurses, the anesthesiologist, and your surgeon. We will make sure you have the right amount of pain relief. So just before surgery, the doctor may ask you to take medication to help minimize the need for stronger meds, such as narcotics, after your procedure. Eliminating or limiting the narcotics you take will get you on your feet faster and help speed up your recovery. Many patients go home the same day they have surgery. But if you will be staying overnight, you will meet another team of caregivers after you settle into your room. Your care team will be made up of doctors and nurses, pharmacists, lab technicians, and therapists. Their names will be on your personal care board in your room. The care board puts important information right in front of you about your care plan, diet, medications, and your goals. And speaking of goals, your enhanced recovery plan will have you getting up and moving as soon as possible, in most cases within a few hours after surgery. We will encourage you to sit up in a chair, walk to the bathroom, and take walks in the hallway. The more you move, the faster you will heal and be able to go home. We will ask you to gradually increase your activity, and soon you will be spending hours at a time up and out of bed. And because it is important to stimulate your digestive system to aid in healing, you will be given clear liquids like water, juice, broth, and Jell-O. Depending on the surgery, you may be asked to breathe through a spirometer to exercise your lungs. We'll show you how.
Hi, Helen. We'll get you your medicine.
During your stay and afterwards, your healthcare team will continue their focus on pain management. We'll do all we can to reduce any discomfort, but the goal is not to eliminate all pain. It's to get you back to your normal activities as soon as possible. Because narcotics, also known as opioids, can trigger harmful side effects that can delay recovery, your care team will teach you about non-narcotic medications and other ways to ease pain, such as NSAIDs, aromatherapy, and relaxing music. Do what works best for you. During your stay in the hospital, the best way to protect against infection is by practicing good hand hygiene. It's critically important that all caregivers and visitors wash their hands to limit the risk of spreading germs that can lead to infections. It's also very important to avoid infection by keeping your incision site clean.
Hi, my name is Jose. You must be Jeff? Yes. Ellen?
When it's time to go home, our case managers are there to help you. You may have questions about being able to afford your medications, finding someone to help with meals, even getting to a pharmacy or a doctor's appointment on your own. If you need assistance, our case managers can help. Once you leave the hospital, it's important that you take care of yourself to avoid complications and help promote healing. When you get back home, you will know how to care for your incision because we'll give you instructions prior to discharge. You should continue to practice good hand hygiene to prevent infections. Make sure you wash your hands with soap and water for 15 seconds. And don't be shy about telling people around you, your family and friends, to follow the same routine. Take any medications prescribed by your doctor. If you are prescribed narcotics, it's important to stop taking them as soon as possible to avoid the risk of addiction. Remember to stick to your recommended diet. As soon as you feel up to it, take walks around the neighborhood and visit with friends and family. Being active is good for you. Call your surgeon's office immediately if you have any problems during your recovery. And be sure to keep your follow-up appointments with your doctor. We want to make sure your recovery stays on track. Thanks for watching. At Scripps, our care team is with you all the way. Your care is our focus. Your recovery, our reward.